Good afternoon. Who am I speaking with? Hello.
Hello, this is Omar, Mohsen, Ibrahim, Fouad.
Hi, this is Dr. Burgos. Hold on one moment, please. Okay. What is your date of birth, please, sir?
December 14th, 1988,
Very well. And where are you located?
in Tallahassee, Florida.
Okay. Um, this consultation will be recorded. I have to let you know that. Is that okay with you?
Yes.
Okay. And I have to let you know that I am a board certified family medicine physician with MD Life. How may I help you?
The lower left side of my back is hurting. There's a intense, sharp pain there. And it's like
Okay.
throbbing,
I see a
aching,
photo
intense,
photo that
sharp
you
pain.
sent.
It hurts really bad.
Only in that particular area, exactly where your finger is?
Yes.
Okay, let's take a look at the other picture. And how long have you been having this pain, sir?
Several days.
Several days. I noticed that you were evaluated in not so long ago by the MD Life physician. Was it that regarding the same back pain?
Yeah, but it still hurts really bad.
Okay. Do you have any fall, any heavy lifting, any incident?
Uh, just me trying to accomplish my necessary living necessities, like cleaning, doing laundry, um, necessary living necessities.
Do you know of anything that may have precipitated the back pain?
What do you mean?
Well, for example, I bent over and the pain started. An action that led to the back pain.
Uh, well, I remember I sat down and I was leaning forward, trying to look at the air conditioning unit, and I felt like something like dislocated from my back, my lower left side of my back, and it was like a really intense, paralyzing pain. Like I couldn't even move for like maybe 5-10 seconds, and it hurt really, really bad. It was like a really intense, sharp pain, and it was like a paralyzing kind of pain. Like I couldn't even move, and I was sitting down on the floor in front of the AC unit, trying to look at it, and I was leaning forward, trying to look at the filter, and I felt that pain as soon as I leaned forward. I reached out my hand to try to look at the AC filter, and immediately I started feeling that pain in my lower left side. Well, my entire lower back. It literally felt like it dislocated. And then now, just the lower left side of my back is hurting really bad. It's a really sharp, intense, aching, throbbing pain.
Okay, so when you called, what medication did they order for you? What kind of treatment did they order?
I don't know.
The last time you were evaluated by MD Life.
I don't know.
You don't know what they ordered?
No.
It was less than a couple of days ago. Let me review your medications. See, because I don't want to repeat the same treatment. Okay, let's see.
I have some, the viscous oral solution 2% lidocaine.
No, that's for when you have a pain in the stomach, like indigestion or acid stomach.
Well, they gave me is like this clear liquid solution. It says like lidocaine hydrochloride, 2% oral solution viscous or something like that for
Yeah,
tooth pain.
I'm looking right at it. I'm looking right at it, but that's not for the back pain. That's not
Yeah,
gonna do
that's
anything
what I
for
was
the
gonna
back pain.
ask you if I could maybe rub some of that on my lower left back to relieve the
No,
pain.
that's not gonna work because that's for mucosa. So that's for your throat. Or if they're gonna put a Foley in, a catheter in your penis, we use that so that it won't hurt. That's not gonna work to the skin. What I see that they might have ordered is methocarbamol, which is a muscle relaxant, and ibuprofen 800. Does that ring a bell?
No.
Those are the two prescriptions that I see here. Did you pick them up from the pharmacy?
No.
Did you go to the pharmacy?
No.
Okay, well, that was prescribed. Methocarbamol, naproxen, all of those are for lower back pain.
Is there anything else that I could use for the back pain other than those things?
No,
Because they don't really work. They
we're
make
not
me like
allowed.
really dizzy and tired and sleepy.
We're not allowed. Oh, so you did pick them up from the pharmacy.
No.
So how did they make you dizzy? And I don't understand. Please explain.
I've
I want to help you, but I
experienced
need
that
to know
before when I had those
exactly.
medications.
Oh, so you had them before. Okay. So, but currently you're not taking any medication.
No.
Okay. Because you have a long list of meds here that I need to clear out because the record is not accurate. You understand? We have a whole huge list of meds. You know, what medication are you taking, if any? Please, so I can just delete all the ones that you don't. I have dozens of medications here. Are you taking any medication presently?
Dr. Burgos, his name?
Yes. Are you taking anything
I just told you
so that I
no.
can just? Okay. So let me go through these. I'm sorry, I did not hear you clearly, so that's why I asked again. I'm just deleting everything else so that we can start from
It's
scratch.
already updated in there. When
No,
I
it's
log
not.
in to
No,
speak to a doctor, it asks me if I'm taking any medication. I already told them no.
everybody says that, and then when I look, not just you, everybody is not up. Until I deactivate them, they remain active. I don't know why the system does that, so it makes you and I work double. It's
What is
not
it like
accurate.
a computer chip activated type of thing or something like
I don't know exactly how the system does it, but I'm doing the same thing that you did before we spoke.
because I noticed
I'm going
there's
one
been
by
previous
one.
situations where they've prescribed medications or there'd be short handwritten notes or doctor's notes and things like that being entered into the computer system, and literally while they're typing, I'd feel my symptoms changing literally while they're typing things about my symptoms. That's why I was asking if it's
Okay.
like computer chip
No,
activated or
no, no,
something
no.
like that.
No, sir, it's not. So the only thing that I have here is Flonase. Are you using that for the nose for allergies?
No.
Okay. And the other one
The
is
only
the
thing
one that
I
you mentioned,
consume
the
is
viscous
food from
lidocaine.
Costco.
Okay, very well. So lower back pain, not radiated to your legs, doesn't go to your legs.
Uh, no, but it's
Okay.
underneath my left toes. Like you know where the underneath the left toes is, like right below it, where the top of the foot is underneath the left toes. That area feels
Okay.
kind of like numbing and numbed and weird a little bit. It doesn't feel normal like the right side. But the
So your
pain
left
in my
toes may be tingling.
yeah, but the pain is
Okay.
really intense and sharp pain, and it's aching and throbbing in my lower left side of my back and in like my left hip
Okay.
area,
Very
like
well.
underneath like my
So
left ribs, kind of. Oh,
I'm going to order some medication, but you're gonna need to see an orthopedic surgeon or a neurosurgeon because you're gonna need an MRI of the back. You may have a pinched nerve, you may have a herniated disc, and on this setup that we have, I cannot examine you. So I only have to go by your symptoms. But according to what you're telling me, that suddenly it began and is quite sharp and quite intense, that's going to require some imaging. You understand?
yeah,
That's going to require an MRI to see your discs. Have you ever had an MRI
yes,
of what area? Of your back?
yeah. Recently, recently and probably like every month since 2018 of my neck. The majority of the time is because of my neck, because of injuries to my neck and my upper back, my lower back, my
So those
left hand,
MRIs,
my legs, my feet.
did they tell you? I'm sorry. Did they tell you anything about your lower back from the MRIs?
Uh, they they always tell me different things, like because it's never the same place that I go to when they do the MRIs or X-rays or CT scans. Some places they tell me uh, the reason why my hands and feet and arms keep going numb is because of the injuries in my neck and the bulging discs in my neck and my back. And some other places that I go to, literally within the same month or the next month, or it's almost the same time frame. They tell me, oh, the MRIs or CT scans or X-rays, they look fine, and I tell them the
Okay.
same thing every time.
So
I don't understand
let me tell you.
how does it look fine if I'm in
Let
pain?
me let me let me tell you what the protocol is when you have the type of symptoms you're having. You need to see a neurosurgeon. Neurosurgeon. They are the ones that deal with the back because inside the vertebrae is the spinal cord, which is part of the central nervous system. If you have an issue of a compression of the spinal cord or any of the nerves that come out of the spinal cord, that needs to be taken care of by a neurosurgeon. Okay? So get the results of your MRI and go see a neurosurgeon until someone with that qualification sees you and tells you what you need to do. You're going to continue to have these issues and have an MRI after the other. The MRI is not going to cure you. The MRI is just a tool that we use to diagnose the issue, and then we send you to the expert to take care of the issue. It may be that you need surgery, it may be that you need therapy, it may be that you need some other approach. But I'm not qualified to tell you what's wrong with you exactly. I don't have the MRI result, and I'm not a neurosurgeon. So I'm going to prescribe something to relieve your pain, but that's not going to solve the problem. You need to see an expert. Okay? In the meantime, besides the medication, local heat may help, massage may help, definitely not lifting, definitely rest, okay, until you better, preferably on a hard surface. If your mattress is not orthopedic, hard, better to put a comforter on the floor and lay down on the floor, on your back. You notice when rescue picks up somebody who's injured, they put them on a backboard because that helps to stabilize the spine. Okay? So you need to address this. Calling us, we can help, but we cannot solve the problem. You understand?
Yeah, and I noticed when I'm laying down on the bed, for example, and when I arch my back, like I kind of like bend my back in, like arching it instead of hunching it over. Like when I arch it, I kind of like lift my torso and stomach and chest like up, like arching it. The pain isn't as
Yeah, I
intense.
understand.
So I think when you mentioned something about the
Pinched
pinched
nerve.
nerve or something like that, and if I think that might be the problem also, because like when I don't arch my back, it feels like there's something like pinching a nerve or something. It's that's causing the really sharp, intense, aching, throbbing pain. And then I notice also when I take a deep breath in and I'm breathing like deep breaths, it feels like the pain is trying to go away. But when I'm just breathing normally, the pain is really sharp and intense.
Yeah. Yeah. All you and I can do is theorize about what it is. The only way to know is by looking at that MRI, and the one person that can tell us what the next step may be is a neurosurgeon. If I were having your symptoms, that's where I would go. Otherwise, you're wasting your time, because you're not getting to the root of the problem. And then if you get to the root of the problem, the person that can give you the solution is the expert, the neurosurgeon. Okay, so I'm going to order you some medication. Let me see what your pharmacy information is. You have a Publix on 101 North Blairstone Road, Tallahassee.
Yes. Florida.
Okay, 32301. So I'm going to send the medication there. Someone will call you within the next 2 or 3 days to make sure you're okay. Do you have any questions?
Uh, do you know any reputable uh neuro doctors that you trust?
That depends on your health plan. You have to contact Humana or look in your booklet and look at the names of the neurosurgeons that participate in your plan in their network. I don't know anyone up in Tallahassee that I can recommend.
How far are you from Tallahassee?
I'm in Miami.
Oh, do you know any of
Yeah,
them that you could trust in Miami that I could go to?
I do, but I cannot make a recommendation like that on this medium. Remember, you're in telemedicine, so I
Yes.
cannot give you any name, and I don't know who you can see based on your coverage. Okay, so I cannot help you from that point of view.
Well, in general, I mean, do you who do you know that's good for these type of situations in Miami?
I know a few neurosurgeons that I send my patients to,
What's
but
the
that's all.
what's the best one you think I should go to?
The University of Miami
Mm.
Hospital. They are the professors. Go in UN, find a doctor, and type in your issue, lower back pain, and you will get a list of doctors. They're all professors. They're all experts.
Alright. I'm supposed to be flying
Okay?
to Miami or to South Florida soon. Um, I could maybe go there at the same time to speak to a doctor. That's what I was asking if you know one that you trust and you know
Yeah.
them. Like,
In that website, once you find the name of the doctor, that also tells you what insurance plans they work with, and if they're taking new patients, so you can make an appointment right on the website. Okay,
All right.
that's the way that you have to go. That's what I would do, because they are the experts.
All
Very
right.
well then. I hope you get better soon.
All right. Well, the medications you said you're gonna prescribe what medications?
The one that I'm gonna send you. I have to study the situation and send you the best possible treatment within the limits that they give me here. I cannot prescribe narcotics.
Is there anything you could prescribe me for the pain that's not gonna make me like tired and sleepy and dizzy?
Yeah, absolutely.
Which one?
Don't worry. I will come up with one. Don't worry. It's not gonna be a narcotic. It's not gonna make you sleepy. It's not gonna make you tired. Promise.
Yeah, 'cause I live by myself, so I need to be like.
Do not worry. You're not gonna be sleepy or tired. You'll be relieved.
And when
Okay,
do
Mister.
you know when they're gonna
Mister.
send the medications to the pharmacy?
That part I don't know. You have to contact the pharmacy. I'm gonna send it immediately, but you need to contact them regarding the dispensing.
But you don't know which one you're gonna send yet?
No, I don't know. I don't like to make a decision, quote unquote, on the fly. I'm going to research the issue, and then I'm going to prescribe you the best possible treatment within the limits of this consult medium, televisits.
Yeah, because
But don't worry.
I was gonna see if I could get them to deliver the medications before they close today. It's already
I will send
3:14
the
p.m.
medication as soon as I end the consult.
All right, is there anything I could do for you?
No, get better. That would be the best thing you can do for me. I hope you get better quickly. It's not. I have experienced back pains, and it's not a pleasant sensation.
It
It's
really isn't.
incapacitating.
It really is, and I hope you never have to experience that type of pain. My father also experiences a lot of back pain, and I really am sympathetic towards you know those types of situations, and especially that type of pain. And it's
Good.
really bothering me. I mean, it hurts so bad to the point where I'm literally trying to sleep all through the night, all through the morning, and my eyes are closed, and I'm trying to sleep, and I'm noticing I'm waking up every few minutes, and I remember myself sleeping, but I also remember feeling the pain while I'm sleeping, and I'm waking up every few minutes, and the pain is still there, and I'm clearly remembering that the pain hasn't stopped, and it's that intense. But
I
I'm so
understand.
tired, I'm trying to sleep. My body's like trying to sleep at the same time.
I understand very well.
And then I'm laying on my stomach right now. I'm laying on my stomach, and I'm like arching my back, and the pain isn't as intense. I notice when I do that also. And like I mentioned to you, when I lay on my back and I arch my back, the pain isn't as intense. But when I'm just laying, relaxing, like normally on my back, trying to go to sleep, the pain is extremely intense. And it's a very sharp, intense, aching, throbbing pain in the lower left side of my back and in my left hip area and underneath like my left ribs.
I understand. So I'm gonna go ahead and send the medication. I hope you get better soon.
Thank you for your concern. And if there's anything I could do for you, please don't hesitate to ask me. I promise I'll try my best to help you.
Very well. Thank you so much.
flu, pneumococcal, shingles, and other vaccines are now available at your Publix pharmacy. Ask your pharmacist for more information or visit our website at www.publix.com/pharmacy. If you know your prescription number and are calling to request a refill, press 1. Prescribers calling to authorize prescriptions, press 2. For our pharmacy hours and location, press 3. To confirm that your prescription is ready, press 4. To speak to a pharmacy associate, press 0 at any time, or remain on the. Please hold while your call is transferred to a pharmacy associate.
Thank you for calling Public Pharmacy. I'm help you.
My name is Omar Mohsen Ibrahim Fouad. My birthday is December 14th, 1988. Are my prescriptions ready?
Give me just one moment, sir. Your antibiotic is ready. Your lidocaine patch insurance is not going to cover for that. Are you okay putting it on discount card? Or do you want to do a prior authorization on that?
The lidocaine patch is not covered?
Nope. So that one we can do a prior authorization to see if insurance will cover for it. But prior authorization means that the doctor will have to put more documentation on it, telling insurance why they need to cover for it.
Yeah, it was prescribed by the MD Live doctor, and I explained to him I have lower back pain. It's really sharp, intense lower back pain, and I need something to relieve the pain that's not going to make me dizzy and sleepy and tired because I live by myself.
That is going to be between the doctor office and the insurance. They will have to do prior authorization on that. So, I mean, I can.
He prescribed it.
Yeah. So, but it doesn't mean insurance will cover for it.
That's not true.
Well, you can talk to your insurance doctor about that, insurance office about that, but that is not what the retail pharmacy do. We can go ahead and start the prior authorization process and let your doctor office know that the doctor office would have to provide more documentation for the insurance, but that's the prior authorization. What it means is just between the insurance office and the doctor office. It has nothing to do with us.
What more documentation do you need other than the doctor acknowledging that I need it?
It's not us. Whatever the insurance is requesting from the doctor office, they will need those information from the doctor office.
What do they need, like a specific medical and billing code or something?
I don't know. It's probably a documentation reasons why you need to be on this prescription.
It's a lidocaine patch for pain that I have in my lower left side of my back that I need to relieve.
I understand your concern, but it has nothing to do with the pharmacy. We don't know. We have to let the doctor know that they need to start a prior authorization because that's what the insurance is requesting. Otherwise, they're not covering for it.
So what do you need me to do?
There's nothing that you can do on your end as of current, but you can let your doctor know that they need to start prior authorization on this script if you want to do something.
It was a doctor from MD Live.
Right. So, I mean, we are sending prior authorization requests to what we have on their fax. We have their fax here with Dr. Rafael Burgos.
Yes.
And so that's what we're able to do. We're sending them a fax letting them know that they need to do a prior authorization.
And they don't know that they need to do a prior authorization?
They don't know that, yes, because when prescription runs through insurance, the insurance will come back to the pharmacy saying what they need, or if it covers. If it not covers, whatever they need. The insurance is letting us know, as the pharmacy, they messaging us know that they need prior authorization. And what prior authorization is that the pharmacy will contact the doctor office to let them know that the doctor has to contact the insurance.
The doctor has to contact the insurance to tell them I need a lidocaine patch because I'm in
Yes,
pain.
correct.
Why does he need to call the insurance to tell them that? They're being billed for it. They're already
That
aware
would
of
be a
it.
question for the doctor. I mean, that would be a question for your insurance. If you want to know more information, you will have to call them. As of right now, that's the message that they're sending the pharmacy. So we have no idea, no clue as to why they need prior authorization. That's what is telling us that we only need to contact the doctor office to let them know they need to start prior authorization.
And what time does the pharmacy close today?
We close at 6 today, but other than that, do you want us to try to put it on a discount card to see how much it is?
I don't have any money. I'm on Social Security disability income. I receive food
Okay, I got
stamps. I don't
you.
have any
Okay,
money.
I do apologize for the inconvenience, sir, but as far as we are able to help you with anything as of right now, we are going to let the doctor know that they need to start prior authorization on the lidocaine 5% patch for you.
Okay, and then what are they? What other medications you said they have ready?
So as of right now, they sent in a prescription for the cyclobenzaprine, which is a muscle relaxant, and that is no charge. So you can come by and pick it up. It is ready for you.
Come by and pick it up. I'm in so much pain I could barely move. I was
I'm
gonna see if I
sorry
could get
about
it
that.
delivered to my
Yeah,
house.
I mean, if that's what you want, then you can go into our app and see and set it up.
Yeah, and when I downloaded the Publix pharmacy app, it said the cyclobenzaprine was ready, but it didn't say the lidocaine patch was ready. That's why
Correct.
I called.
Uh-huh. So that's why what's happening with the lidocaine.
Okay, so pretty much I'm waiting now for them to receive the fax saying they need to send prior authorization to for the lidocaine patch to my insurance company so I could receive it.
Yes, sir.
And how long does that usually take?
Um, approximately, it can take up to from 3 days up to a week.
3 days up to a week,
Yeah,
and the doctor's prescribing that for me because I need it now, and I have to wait 3 days to a week.
yeah. Or you can call the doctor back and let them know.
Or I can go to the emergency room and they bill my insurance thousands of dollars, and they give me
I'm
one
not,
little pill
I'm, I'm
and
not
then
gonna be able to
MRIs.
tell you
Like
what to
that's
do.
insane.
Yeah, I'm not gonna be able to tell you what to do in this situation unless you want me to fax back the doctor and see if they could send in an alternative medication. But that's gonna take some time too, because whenever they receive the fax, that's when they'll probably send in a new script.
Yeah, I need
I'm
something that's
honest
gonna
with you.
get rid of the pain. It's not gonna make me sleepy and dizzy and tired.
I don't have a timeline for you, so there's two things I'm going to be able to do for you right now. One, either wait, send the doctor office a message saying, like, fax the doctor office and let them know that you need to do a prior authorization, or two, send back the prescription to the doctor office and let them know that this prescription needs is not really it needs a prior authorization. Can you send in something new? Um, Send an alternative so that it can cover under insurance. Those are the only two
What's an
processes.
alternative to a lidocaine patch?
Alternative to lidocaine, that really depends on the doctor, whatever they feel fit.
Because they prescribed me lidocaine hydrochloride 2% oral solution viscous for my teeth pain. That was covered. Why isn't a lidocaine patch for my back pain covered?
Sure, that's a question for your insurance.
But you would think it would be covered, right? It's the same thing as lidocaine.
Uh, there's a lot of things that insurance do that I don't even, I don't understand either. I'm sorry.
So were you able to send the fax yet?
Yeah, so I already sent a fax saying that they need the prior authorization, but I don't know if you want me to do the second option. So you have to do either or. Do you want the prior authorization process to start, or do you want me to send the doctor like ask them if they could send an alternative prescription?
Well, I don't know what's better. I don't know what alternative they're going to prescribe. I don't know if, the alternative is better than the lidocaine patch. I don't know if
Okay.
it's going to be quicker for them to send an alternative to the lidocaine patch. I don't know. I don't know. I'm not a doctor. All I know is I have severe, sharp, intense aching and throbbing pain in my lower left side of my back.
Yes, sir. So, I mean, it's really up to you. I can't tell you about the timeline. That's not to my knowledge.
Mine either.
Yeah, that's really unfortunate. I'm sorry.
What? So what do I do?
You have two options. I don't know what you want to do. You want to wait for prior authorization? Takes about 3 to 7 days,
Do
depending
you
on
mind
the.
if I call my insurance company on three-way and tell them so we could all be on the same page and they could speed up this process?
I'm sorry. What is it?
Say that again.
I didn't hear you.
I said, do you mind holding on for a minute? I'm gonna call my insurance company on three-way so we could speed up this process.
I can't do anything. I can't. I don't call your insurance
No,
company
I'm gonna
for
call them
advice.
on three-way.
You can't even do that because they're gonna need documentation from the doctor office.
Yeah, the
They're not
doctor already billed
authorized,
them from MD Live.
right? But it's not. That's just not a prior authorization. You and I will not have anything to do with the process.
Yeah, but so they're paying for it, is what I'm saying. All it needs to be is paid for. Prior authorization just means it being funded. So if me
Prior
calling them
authorization
on
means they
three-way
need
it'll speed up the
documentation.
process.
Yeah, I mean, you can call the doctor office and call the insurance, but I will not have anything to do with that.
But what I'm saying is if I call them on three-way and I explain to them that the pharmacist is on the phone with us right now, she's trying to speed up this process for me, and she's saying I need a pre-authorization so I could obtain the lidocaine patch because I'm in pain. They'll speed up the process because they'll acknowledge that we're both acknowledging that this needs to be uh, pre-authorized or whatever it's called, so they can hurry up and uh, pre-authorize it so I could obtain my medication.
Okay. I mean, you can put me on the phone with the insurance, but they will not need me for it. They will need the doctor to send them documentation. As of my
Yeah, they,
part,
they, they were already billed. That's what I'm saying. They have the documentation. They have the consultation. They probably even were listening in on the phone call. I mean, I'm
sir,
gonna call them real quick before it gets too late. Hold on one second, please.
Emergency, please hang up and dial 911. Calls may be monitored or recorded to ensure quality of service. Para español, oprima el ocho. To get started, which of these sounds right for you? Say, I'm a patient. I'm a provider. I'm calling from a pharmacy. Or say, none of these.
Representative.
I know you'd like to speak to someone, but to get you to the right your
Hi, thank you so much for calling MD
Hey,
Library
the
North,
pharmacy said they
exclusively
need a
available to use your care.
pre-authorization for the lidocaine patches.
I'm so sorry, sir.
The Publix pharmacy said they need a
Uh-huh.
pre-authorization for the lidocaine patches.
Okay, I just wanted to verify here that your pharmacy needs to have a prior authorization from your insurance, correct?
That's what they said.
Let me check. Okay, so for this, sir, I just need to pull up your account so that I can certainly help you further here. Can I have your full name and date of birth?
No, you cannot have it. My full name is Omar Mohsen Ibrahim Fouad. And no, you cannot have my date of birth. My date of birth is December 14th, 1988.
Thank you so much for this, Omar. And may I know also what is the phone number on your account here, please?
My phone number is 772-538-8586.
Okay, thank you so much. For a moment, let me go ahead and pull up your account.
Oh.
Lidocaine topical patch. Okay. All right. So for this, Omar, I just wanted to verify here. Are you in the state of Florida right now?
I live in Tallahassee, Florida.
Okay. And is your best callback number the phone number 772-538-8586?
Yes, that's my phone number.
Okay. Okay. So what I'm going to do here, Omar, is I'm going to submit an escalation to our clinical staff so that they are the one who is going to process the prior authorization from your insurance here, okay?
Okay, could you hold on one second? Let me call the pharmacy on three-way so we could speed up this process. Hold on one second.
I'm sorry?
Hold on 1 minute. I'm gonna call the pharmacy on three-way. I was just speaking to them. Hold on 1 second,
Mm-hmm.
so I could tell them. Hold on.
Thank you for calling Public Pharmacy. May I help you?
My name is Omar Mohsen Ibrahim Fouad. My date of birth is December 14th, 1988. Did
Oh,
they
yes, sir.
send
We were
the
calling.
lidocaine patch thing yet?
We were just calling. Gonna call you back. The doctor did just call us. Doctor Rafael called us and said that we can the prior authorization did not go through for the insurance, so they will call you back just to advise you to get the over the counter Salem Pass instead.
Get over the counter what?
Over the counter Salem Pass.
I don't have money for that though.
I That's what the doctor said. They want me to go ahead and
Please hang up and dial 911. Calls may be monitored or recorded to ensure quality of service. Para español, oprima el ocho. To get started, which of these sounds right for you? Say, I'm a patient. I know your.
Thank you for calling MD Library North. This is Maria. How may I assist you today?
Rachel just called me and the phone hung up.
Hello?
Rachel just called me and the phone hung up.
So, just to confirm, sir,
My
this
name
is
is
not a
Omar
proper
Mohsen
provider.
Ibrahim Fouad. My birthday is December 14th, 1988.
Uh-huh. And they have an MD Live consultation today, sir.
Uh-huh. Rachel from MD Live just called me and the phone hung up. Could you tell her to call me back or connect the phone to her or what?
Just give me a second.
I
Let
think
me
she's a
pull up the
nurse or
account first.
something.
Let me pull up the account first, sir, so in order for me to double check, okay? Bear with me, sir. Can you help me verify your account, sir? Using the phone number that I gave.
772-538-8586. It's my phone number.
So upon checking it here, it shows that our nursing team he tried to call you, sir, to inform um, give me a second, because she coordinated actually with your provider.
So are you gonna tell her to call me back, or are you gonna connect the phone to her, or what are we doing?
So what I'm going to do here, sir, I need to re-escalate this to our nursing team, so they will be the one to
How long is it gonna take for her to call me back? Or how long is it gonna take for you to connect the phone call to her?
I don't have the option, sir, to reconnect
She
the
called me
phone.
from this same number, 1-800-400-6354, literally right before I called this phone number again and you answered the phone.
Okay. Can you try, sir, to save the phone number that you will be using?
1-800-400-6354.
Yes, sir. Can you save that one, sir, in your contact? So I will re-escalate the information
Save it in my contacts for what?
to avoid or to prevent the call
She
from
just
escalating.
called, I answered the phone, and she said this is a nurse, Rachel, or Rachel from MD Live. I'm a nurse, or whatever. And then I was trying to, uh, like, hold the phone so I could talk to her, and the phone hung up.
Yeah, because actually, sir, on the notes that she puts it here, she's trying to advise you, but the call got disconnected, sir. So on this one,
So
in
could
order
you
for
tell
me
her to
to
call me again right
yes,
now?
sir.
I have things to
Re-
do.
okay, I will escalate now to our medical team. Okay, kindly just bear with me, sir. The same phone number, sir, to be associated, the 772.
772-538-8586 is my phone number. 772-538-8586. The same number I'm calling you from now, the same number they called me from. I mean, the same number they called me on. Same number that's registered to my account.
All right, sir. I successfully submitted the escalation. I already tagged this as a high priority, sir. So can we just wait for a call back from our nursing team, okay? And
And how long is
I
that going
highly
to take?
so once they already receive the escalation, sir, they will give you an update. They will call you back.
So how long is that going to take?
I couldn't confirm the time, sir, but within this day, sir.
Hi, this is Rachel, one of the nurses at MD Live on a recorded line, calling back for Omar.
Hello, it's Omar.
Hi, can you hear me okay?
I can hear you loud and clear.
Okay, Awesome.
Hi, thank you for calling MD Live
Yeah, the
Tonight.
phone hung up again.
Yeah.
Could you tell Rachel to call me again?
Oh, I really do apologize for the inconvenience. Yeah, sure. Let me go ahead and double check your account here on my end, and I'll be very happy to assist you. We have your first
My
and last
name? No,
name.
you cannot have my name. My name is Omar Mohsen Ibrahim Fouad.
And
My
how about your date of
birthday,
birth?
you cannot have my birthday. My birthday is December 14th, 1988.
And how
My
about
phone
your
number
phone
is
number, please?
772-538-8586. Could you tell
Okay, thank you.
Rachel to call me again? She literally just called me
Okay.
again and the phone hung up again. So could you tell her to call me again?
Okay, got it. Let me go ahead and double check the information. Okay, got it. So actually, I double checked the information here on my end on your appointment, which is an urgent care, and I can see that Rachel already ended your call, with the 24 minutes, and of course, she already marked as completed your consultation. So, as far as I really love to reconnect with you with Rachel right now,
What
but
are you talking
unfortunately,
about? I recorded the call when she answered the phone.
mm,
She said, "Can you hear me?" I
mm-hmm.
said, "Yes, loud and clear." And then the phone hung up again on accident. We were on the phone for 30 seconds, less. Could you tell her to call me again? Because the phone hung up on accident.
Mm-hmm. Okay, I really do
We're
apologize
not on the
for the
phone for no
inconvenience.
24 minutes. She didn't complete the call. None of that nonsense lie that you're saying. Tell her to call me again right now.
Mm. As far as I really love to reconnect with you.
Let me speak to the supervisor in America.
I'm so sorry, sir. Whom do you like to
Let
speak
me
with?
speak to the supervisor in America. Thank you.
You want to speak with a supervisor from Medicare,
Thank
correct?
you.
I'm so sorry, sir, but I can really help you out unless you provide me
Let
the
me
details.
speak to the supervisor in America. Thank you.
We don't have here, sir, direct
Let me
contact.
speak to a supervisor now. Thank you.
Sir, in order for me to connect you over to one of our supervisor, I
You're
need
a
to verify
liar.
some details.
Let me speak to the supervisor. I don't trust you.
Sir, I can't really connect you over to one of our supervisor unless I do have here your
My name is
information.
Omar Mohsen Ibrahim Fouad. My birthday is December 14, 1988. My phone number is 772-538-8586.
All right, I'll try to reconnect you over to one of our supervisor, but please bear with me, okay? Hold on.
No, I don't like you. I don't trust you. I don't want nothing from you. Put the supervisor on the phone. Thank you.
Sir, I'm still trying to reach out to one of our supervisor. Would you like to continue to wait?
Hurry up.
Again, I'm trying to get in touch with one of our supervisor. Please give me 1 to 2 minutes. Are you still willing to wait?
Hurry up.
Your contact information, and you will receive a call back as soon as possible.
Record your message at finished. Hang up or press.
Necessity?
Let me speak to the supervisor. Thank you.
Yes, Nerys, I can definitely assist you in escalating your concern to one of our supervisors, and may know what would you like what is the reason why would you like to speak to one of our supervisors?
It's none of your business.
May I know what is your full name as well as your date of birth, enable for me to
No.
actually.
Okay, yes. As much as I want to connect you to one of our supervisors, but we cannot able to do that one, sir, if we cannot pull up the account of the patient. So if you'd like me to, I can definitely connect you to one of our supervisors, but I need to ask your full name as well as your date of birth.
Hello?
Let me speak to the supervisor. I don't trust you. Thank you.
Yes, sir. I fully understand that you'd like to talk to one of our supervisor, but we still need to confirm the information of the patient in order for us to completely pull up the account. So if you'd like me to, I am more than happy to check your account, but I need to ask your full name as well as your date of birth.
Let me speak to the supervisor. I don't trust you. I don't want to talk to you. I don't like you. Put the supervisor on the phone. Thank you.
Yes, as much as I want to, sir, but actually on the process here on the MD Live,
I
we
don't
cannot.
care. Let me speak to the supervisor.
Yes, sir. I fully understand. I really want to assist you regarding on your concern that you'd like to speak to one of our supervisors, but in order for us to connect you to our supervisor line, we need to ask your information, like your name as well as your date of birth.
Let me speak to the supervisor. Thank you.
Yes, sir. But I need your information, please, in order for me to fully assist
Let
you
me
and help.
speak to the supervisor. Thank you.
You're welcome, sir, but I still need your information because we cannot pull up the account or to escalate the
I'm
concern
calling
of our.
from my registered number. Let me speak to the supervisor. What don't you understand? I don't trust you. I don't like you. I don't want to talk to you. Put the supervisor on the phone now. Thank you.
Yeah, sir. Even though that I know that you don't like to talk to me, but
So then
still,
put the
sir,
supervisor on the phone. Hurry up.
Yes, sir, but I cannot able to do that one, sir.
I don't care. Put the supervisor on the phone. Able to do that. Thank you.
yeah, sir. I can do everything or the thing
I
that you
don't
need.
care. Put the supervisor on the phone. Thank you.
Yeah, sir. But in order for us to connect you to our
I
supervisor, I need to
don't
ask.
care. I don't want you. I don't need you. I don't like you. I don't trust you. Stop talking to me. Put the supervisor on the phone now. Thank you.
Yeah, sir. I know that you'd like to
Stop
directly.
talking to me. Put the supervisor on the phone. Thank you.
Yeah, sir. As much as I want to, but we cannot connect the call. I know that you
I
don't like
don't
to.
care about your excuses. You're a liar. Put the supervisor on the phone or else.
I'm so sorry, sir, but we cannot.
Thank you.
I'm so sorry, sir, but we still need your
Thank
information.
you. Put the supervisor on the phone.
As much as I want to, sir, but I need to